Welcome to the Research Rundown, and the research we're going to attach to this brief segment is really an overview of what's going on in the hyperbaric oxygen world, who has really driven it to where it is today. For somebody that's deeply involved in some of the background, know many of the doctors, I would say that this is a pretty good overview of what's going on. What it doesn't really cover is, to me, some of the politics that go on in the background and some of the roadblocks that have been put in place to prevent hyperbaric oxygen from being utilized for many more indications than it currently is being utilized for. But it does give a good background, and it covers a lot of ground here. Title of this study is, it's a general overview on the hyperbaric oxygen therapy applications, mechanisms, and translational opportunities. So it looks at what it's being used for and what it could be used for potentially in the future. And so understanding really the politics behind this, I think, is important and should not be the reason why you don't seek out hyperbaric oxygen when it comes to any inflammatory condition that you're dealing with, because it is such a powerful anti-inflammatory. And so just kind of covering one topic that's in here outside of the overview of those mechanisms is it just briefly touches on cancer. And so this is sort of the general theme you'll find with some of the other indications that you deal with. And so just to read the beginning of it, the use of hyperbaric oxygen as part of cancer therapy is not currently an approved indication, although some promising results have arisen recently. Well, I wouldn't necessarily call it recently. I would say that there's been promising results for decades. And so I think it's time that we just, sort of release the Kraken on this one. And we should be using hyperbaric oxygen for many more things because of its anti-inflammatory benefits. And the fact of the matter is that most of us are going to die of something inflammatory related. So if we can reduce inflammation, we need to move quickly and move forward with hyperbaric oxygen if we're suffering from some inflammatory disease. So hopefully you get a chance to look at this. One last thing I would say is that when I first started looking at hyperbaric oxygen some 10 years ago, I looked at the Cochrane reports. Yeah, the Cochrane reports. I think there's some bias there. They are very slow to the race, and unfortunately, I think they've been a roadblock. And it's time for us to really look at the research and understand the fact that there are tremendous benefits with hyperbaric oxygen, no matter what inflammatory issue you're dealing with. And by avoiding it and not using it because it's not been approved through some peer-reviewed clinical trial, I think is criminal. And it's safe and it's ineffective. And so with a credible clinic that uses hyperbaric oxygen therapy, you're going to find doctors that are going to make sure that you don't have contraindications that might prevent you from getting a treatment. So that would be my recommendation. Hope you get a chance to read the report and be aware of what some of these agencies are saying that really are opposed to moving quickly on something that is safe and effective. And I wish they wouldn't do that. Thank you.